Almost a year ago, next week as a matter of fact, visiting our kids out of town in Pennsylvania, I had the very frightening experience of waking up with a total inability to see anything out of my right eye.
Judy contacted KU Eye and flew home the same day. With 3 different procedures over the next several months, Judy's doctors repaired a severe retinal tear and performed what she calls her miracle.
This morning on my 1-year checkup, I was able to read 20/20 on the eye chart with my right eye.
The foundation for Judy's recovery began 100 years ago when Dr. E.J. Curran was hired as chairman of the new University of Kansas Department of Ophthalmology, something unique for medical schools at the time. Curran was well trained for the position, as chief resident under Dr. William Osler at Oxford. Over the next 35 years, he grew the department and began training medical students in ophthalmology. Dr. Curran may be best known in medical circles for developing what became the standard treatment for angle closure glaucoma. But at the University of Kansas, he's celebrated as the founding father of the ophthalmology department. And his sons and grandson continue his legacy.
I, of course, feel that my grandfather gave me a lot of opportunities. One of them was to be a graduate of this program. But if there is a gene for humanism, I got it. Humanism means that the patient knows the doctor is with the patient. It's not reducing the patient to a lab value.
Dr. Albert Lemoyne shared the same focus on the patient during his tenure as department chair from 1950 to 1980.
When I was a resident, Al had the room set up so that all the residents had to sit in the same room and see their patients together. So we got to learn from the first year, second year, and third years how to do it. And Al had his door open at all times across the hall, and he wanted to see every patient with us. The patients are number one, and I think that's why I'm still around here as an alumni, is that I really believe that that's what makes us a great department.
37 ophthalmologists graduated from the residency program while Dr. Lemoyne was chair, and the department became a full academic program. Dr. Lemoyne also developed a relationship with the Lions Club that's resulted in substantial funding for the department, including the Kansas Lions Sight Foundation.
The foundation initially was created to form a professorship. That was the Lions' mission. And for a number of years they raised money for that purpose, but when the time came, it made more sense to use that money as a research foundation. So the Kansas Lions Sight Foundation endowment was created, and over the years several $1 million have been expended from it, all in the name of helping people either to prevent blindness or resolve blindness.
I was privileged to be taught by some top-notch clinicians. My late associate, Fred Hyde, brought using a microscope to KU in the 70s, and he was an esteemed mentor for a number of us. There were a lot of wonderful faculty members over the years, and also colleagues that went on for fellowship, that is training elsewhere, came back to the community. We have others that have gone all over the country, but I think all of us agree that the foundation of training at KU Eye Department was a significant addition to our knowledge and prepared us well for going wherever we went.
In 2006, Dr. John Sutphin took over leadership of the department. A retired Navy captain and professor emeritus at the University of Iowa, Dr. Sutphin is nationally known for his expertise in cornea diseases external diseases, and for anterior segment surgery. He's also an active leader in national ophthalmological organizations. As chair at KU, Dr. Sutphin immediately put his experience to work and developed a plan for growing the department, along with the care and education it could provide.
I think the attitude of our department has become much firmer under Dr. Sutphin's direction, in that he seriously and sincerely wants to help people. And that's that the end result is that it shows, I think, in the care that they get here.
Having been through the program as a resident and now being on the other side as faculty, and having seen residents from other departments and students from other departments, I appreciate the dedication that Dr. Sutphin has in leading the department and prioritizing teaching.
With the support of Dean Barbara Atkinson, the department, now known as KUI, moved from the Rainbow campus to its current location on State Line. Today, 3 or 4 times as many patients are seen there as in 2009. And in 2014, the new ambulatory surgery center opened at KUI, creating more opportunities for outpatient procedures and hands-on surgical training, both important as new tools and techniques become available. Some of the major advances in the field over the years were made by KU department faculty, like Professor Knoll's discovery of photic retinopathy that revolutionized the understanding of how light affects the eye. Dr. Mainster developed materials now used in almost every cataract operation and most retinal laser procedures. And looking ahead, there is no limit to the possibilities for KUI discovery and innovation.
The wonderful thing about the department under Professor Sutphin's leadership is that we've assembled now a critical mass of very, very talented young faculty members and some extremely knowledgeable senior faculty members. So where we stand now is poised to move forward to the next level, where we begin to not only expand our clinical resources, but hopefully begin to establish the department as a vital source locally in both technical and scientific research in ophthalmology.
And we have opportunities to work with our friends at the University of Iowa or other institutions to collaborate, to find the cures, not just the causes, but the cures for many of these genetic diseases which plague us. If we had the resources, we could collaborate more extensively. If we had a lot of resources, we could create many of the same types of opportunities within our own community to create and have a tissue lab that would help us solve problems of the ocular surface, or to create a lab where we could actually modify the patient's genes and give them back to their retina, allowing them to see. And we would delight in being able to bring those types of opportunities to our own city and to our own region.
But for all that's changed, at its core, the department remains the same: proud, principled, and constantly striving for the next level.
I'm very proud of what we've been able to achieve over time, adding innovative things to therapies for patients and providing an atmosphere of concern and caring for the patient. And I think that expands out to our trainees, our residents and medical students, and also our technicians who learn from us as well. We are all doctors, and doctors are teachers, and that's what we're all about. We're all about teaching.
I think every resident will remember the exact time that they did the first cataract and that patient comes in the next day and they have 20/20 vision and they look at you and say, oh my gosh, I can see, I didn't realize what I was missing in life, and they get excited and thankful. I think that every resident can tell you and remember who that patient was. It's just an amazing experience to know that you can impact someone's life that much.
KUI is the caretaker of a great medical legacy here in the Midwest. one that combines patient-centered values and clinical excellence. It's much more than science. It's a great work in progress. With the help of a supportive community, who knows what breakthroughs KUI will see in the next 100 years.